ಹಾಯ್ ಎಲ್ರಿಗೂ ನಮಸ್ಕಾರ. ನಾನು ನಿಮ್ಮ ಸಂದೀಪ್. ಸನ್ಶೈನ್ ನರ್ಸಿಂಗ್ ಸ್ಕಿಲ್ ಸ್ಟುಡಿಯೋಸ್ಗೆ ಎಲ್ರಿಗೂ ಸ್ವಾಗತ. ಸೊ ಟುಡೇ ಐ ಆಮ್ ಹಿಯರ್ ಟು ಟಾಕ್ ಅಬೌಟ್ ವೈಟಲ್ ಸೈನ್ಸ್ yet again, but this time we are going to talk about the vital signs procedures. That is, we are going to talk about each and every single vital signs procedures in detail. How are we going to do these procedures and what are the instructions that is need to be carried out during these procedures? How important it is for the nurses to understand about these procedures so that they can apply these skills in their day-to-day life when they go to the hospitals. So these are the things which we are going to see in detail. Measurements of vital signs is a very important skill that every nurse needs to apply in her professional life. Let us start with the equipments that we need to keep it ready before we go to a patient to check the vital signs. So these are the equipments. And let's begin with the temperature. So firstly, let us know about the temperature. The normal body temperature is 98.6 degree Fahrenheit, that is 37 degrees Celsius. The factors affecting the body temperature is age, cardiac rhythm, exercise, hormones, stress, environment. The common types of fever: intermittent fever, remittent fever, relapsing fever, constant fever are some of the fevers that we come across in our nursing life. The sites of measuring temperature already as explained: oral, rectal, axillary and tympanic. So it is measured through the thermometer. So how to measure the body temperature? That is through orally. So these are the steps that you need to follow. To start with the procedures, we need to follow some basic principles like washing our hands, gathering the articles like glass thermometer, gauze piece, watch clock and writing materials to record the temperature. Oral temperature is one of the commonest method to measure the temperature, and it is done by placing the thermometer below the tongue, that is sublingual region. Measuring the temperature through orally is not advisable for the patients with the following conditions. Other way of checking the body temperature is through a rectal, where a thermometer is inserted into the rectum or anus. Procedure for checking the rectal temperature is as follows, which includes for both adults as well as for the infants. This picture shows the way to insert the thermometer inside the rectum of infant and adult. The following are the conditions where we need to avoid using this method to check the body temperature. Let's talk about one of the safest way of obtaining the body temperature: axillary temperature. It is one of the safe and inexpensive and not recommended for young children. The steps we need to follow while conducting this procedure is as follows. The picture which is being displayed here shows the way to place the thermometer between the arms to get the accurate reading. The other way to obtain the body temperature is by using a tympanic thermometer. It is also one of the methods to check the body temperature, and the procedure is as follows. Overall, to measure the body temperature, these are some of the commonest types of thermometers that we use in the hospitals. The normal temperature that we obtain through various routes is as follows. Pulse. It is considered to be one of the most important vitals. The normal pulse rate in a healthy human ranges between 60 to 100 beats per minute, and it is assessed for rate, rhythm and volume. Some of the factors that affect the pulse: age, gender, body build, exercise activity, stress and emotions, body temperature, blood volume, drugs. The following are the sites where we can feel the pulse. The method used to check the patient's pulse is by placing your two fingers on the patient's wrist to get the accurate pulse rate. And the normal pulse rate for an healthy adult is between 60 to 100 beats per minute. Also, when we check the pulse, we also check for the pulse rhythm and also the pulse volume. Respiration is an act of breathing which includes intake of oxygen and removal of carbon dioxide. Now let us learn how to check the respiration rate in a patient. The chart here tells us the normal respiratory rate in the different age groups starting from newborn to adults. Blood pressure is the force exerted by the blood against the walls of the arteries in which it is flowing. There are two types of blood pressure which we record in a day-to-day basis. One is systolic and another one is diastolic pressure. Some of the factors that affects the blood pressure are as follows: fever, stress, arteriosclerosis, exposure to cold, obesity, hemorrhage, external heat. Sites for measuring blood pressure: upper arm, thigh around popliteal artery, forearm, leg using posterior tibial. The equipment used for checking the blood pressure is by two ways. One is by using the digital and another one is by using the manual one, that is with the help of mercury. The procedure to measure the BP is as follows. The fifth vital sign includes pain. The assessment should include location, intensity, character, frequency, and the duration. The pain is considered as a vital sign because it can affect the other signs and it is important to take into account. Now, how to monitor the pain? The pain can be monitored by using the pain assessment model, and also the pain can be assessed by using a numeric rating scale.